Predictive modeling is a process of modeling historical data for predicting future events. For example, we want to use electronic health record that we have available to view a model of heart failure, so that we can predict patients who are at risk of developing heart failure sooner. Predictive modeling is not a single algorithm, but a computational pipeline that involves multiple steps. The key goal we want to answer in this lesson is how do we develop a good predictive model using electronic health record quickly. First, we decide the prediction target, for example, whether a patient will develop heart failure in the next few years. Second, we construct the cohort of relevant patients for the study. Third, we define all the potentially relevant features for the study. Fourth, we select which features are actually relevant for predicting the target. Fifth, we compute the predictive model, and sixth, we evaluate the predictive model. Then we iterate this process several times until we are satisfied with the resulting model. Prediction target. There are often many targets that an investigator wants to predict using the data they have. However, only a subset of them are possible. So, we should choose the prediction target that addresses the primary question that is both interesting to the investigator and possible to be answered using the data. In this lecture, let's focus on predicting the onset of heart failure, which is an interesting and potentially possible target. Motivations for early detection. If we want to develop a predictive model for heart failure, what are the motivations for early detection of heart failure? First, heart failure is a complex disease. There is no widely accepted characterization and definition of heart failure, probably because the complexity of the syndrome. It has many potential etiologies, diverse clinical features, and numerous clinical subsets. If we can detect heart failure earlier, we can potentially reduce the cost of hospitalization associated with heart failure. We can also potentially introduce new early intervention to try to slow down the progression of heart failure, improve the quality of life, and reduce mortality. In the long term, we can improve existing clinical guidelines for heart failure prevention.